My name is Cindy Kravitz. I'm a pediatric nurse practitioner here at Progressive Pediatrics. Today, we are going to talk about kitchen safety and what to do when you get burned. As we enter the holiday season, many of us will be in the kitchen. So I am going to provide you some helpful kitchen safety tips. First thing I would like to discuss is the importance of always being present when cooking. Child safety is important. It is recommended to use a gate such as this. Avoid holding your infant and trying to cook at the same time. 2 hands are recommended. Keep your stovetop clean. Grease and buildup could ignite easily to start a fire. Always use the back burners and turn the pot holders towards the back to avoid a child pulling it down. Oven holders are not meant for dish towels. They're there to help you pull the oven down. Avoid putting a dish towel on the oven rack. When taking things out of the oven that are hot, it's best to use oven mitts. When taking your turkey out that can be heavy, body mechanics are recommended to help decrease injury from the lower back. It is important to squat down and lift up. Always place the hot food in the center of the counter, avoiding a child from coming and tipping the hot contents over. And always make sure to have a fire extinguisher in your kitchen and familiarize yourself with how to use it. What happens if your child gets burned? Stop the burning process and get the child to safety. Remove any clothing near the skin, but if something is stuck to the burn, it is best to leave it there, not to pull off the skin of the burn. Cool the burn with lukewarm to cold water for 20 minutes. It is not recommended to use ice or ice packs directly on the burn. How do you know when to proceed to the emergency room? Burns of any size that result in white or charred skin. Burns on the face, arms, legs, or genitals that begin to blister, any chemical or electrical burn, and anyone with an underlying medical condition that sustains a burn should go to the emergency room. What can you expect when you get to the emergency room? Depending on how the burn happened, a tetanus shot may be given in order to prevent infection. They might use something like this with normal saline to clean the burn. Creams such as Silvadene can be used and placed directly on the burn. That will then be secured with a wet to dry dressing. You will be given a set of directions of how to care for the burn. Depending on the degree of the burn, it might take up to 2 weeks to heal. If it's severe, you might be asked to follow up at a burn center. Hopefully these tips will get you through the holiday season safely. Again, I'm Cindy Kravitz at Progressive Pediatrics, where we have 2 offices, one in Bayonne, New Jersey, and one in Union City, New Jersey. We are open 7 days a week and always here to answer questions or concerns. Have a safe and wonderful holiday.